Navigating your prescription benefit plan. Pharmacy Benefit Managers, PBMs. A pharmacy benefit manager, or PBM, is the company that designs and manages your prescription drug benefits. But they do much more than fill your prescriptions. PBMs manage pharmacy benefits for insurance companies and employer-provided plans, as well as Medicare Part D and Medicaid. You see, drugs do not go directly from the manufacturer to your local pharmacy. There is a complex supply chain with several middlemen that each play a role. PBMs handle drug price negotiations and payments with the drug manufacturers, distributors, and pharmacies. In short, PBMs work to control costs by controlling how you access healthcare services. PBMs use several practices designed to save the health plan money, but these cost control measures may negatively impact people with cancer. So let's take a look at each of these practices and how best to navigate them, starting with formularies. PBMs decide which drugs will be included in or excluded from coverage. This information is outlined in a list called a formulary. The formulary includes generics, brand name drugs, specialty medications, and biosimilars. The formulary is arranged in pricing tiers that encourage the use of drugs that are less costly to the health plan. Get familiar with your formulary. You can find it on your plan's website or by calling member services. Check to make sure any drug you're prescribed is on the formulary. If the drug is not on the formulary or it's on a high-cost tier, talk with your doctor about your options. The sheer volume of prescriptions handled by PBMs gives them bargaining power with drug manufacturers. PBMs may also offer manufacturers a preferred spot on the formulary in exchange for a cashback rebate on a drug's list price. Drugs with higher list prices are better able to offer larger rebates. This could incentivize the PBM to give a higher-priced drug a preferred position in the formulary, even if a lower-priced drug would actually be cheaper for you or the overall plan. Exactly who gets these rebates is not always clear. There is a growing demand for greater transparency coming from lawmakers, patient advocacy groups, and independent pharmacies. It's worth noting that when you go to the pharmacy and pay for a drug, the list price you see is often much higher than the price the PBM or the plan pays after rebates. This can impact your copay, and if you have a high deductible, the amount you might pay for a drug out of pocket. Pre-authorization, also called prior authorization, may be required before your insurance company will cover certain drugs. The idea is to make sure the drug prescribed is, quote, medically necessary, especially if there are less expensive drugs available. Pre-authorizations are usually handled by your doctor's office, but sometimes the process of obtaining pre-authorization can delay your treatment, limit your access to certain drugs, and cause stress. If you're faced with a pre-authorization, talk to your healthcare team. They can help navigate the process and can also let you know if there's a suitable drug that might not require prior authorization. If you need the specific drug your doctor prescribed and it's urgent, your doctor can request an expedited review. Step therapy may be required if your doctor prescribes a higher-priced drug or a non-preferred drug according to the formulary. Step therapy is also known as a fail-first protocol because it forces you to first try one or more lower-tier treatments on the formulary to save the plan money. If these treatments are not effective for you, or if you can't tolerate the side effects, or if they cause you other health problems, then these treatments are considered a fail. Only then will the health plan cover what your doctor had originally prescribed. Anytime your doctor prescribes a new drug, ask if it might trigger step therapy. If it might, ask if there is an alternate drug that would work for you. Your doctor may also be able to request an exception for you based on medical necessity. In either case, make sure to let your doctor know about other drugs you may have already been on and how you reacted to them. Many cancer medications need special handling and careful patient monitoring. Prescriptions for these medications are often processed through specialty pharmacies. Since specialty pharmacies are frequently run by PBMs and major insurers, they can require you to use the specialty pharmacy specified by your health plan rather than your doctor's pharmacy or your local pharmacist. Be sure to carefully track these shipments and arrange delivery when someone will be home. At some point, you or someone you know has likely had a claim denied. It's important to understand that PBMs may use computers to automatically make these decisions based on a set of programmed guidelines or algorithms. Or it may be a human looking at your claim who might not be a cancer expert. But you have rights. Claim denials can be appealed, and patients are often successful in getting denials overturned. Let your doctor's office know you've been denied. They can help to make your case. Sometimes it's as simple as a billing code error. Your insurance company must respond within a certain time frame. If you aren't getting anywhere with your insurance company, you can request an external review. You can also reach out to your benefits office or to your state Department of Insurance. The oncology social workers at CancerCare are also available free of charge. They can help you navigate your situation and direct you to additional assistance. Advances in research have led to amazing breakthroughs in the treatment of cancer. But these new, life-saving drugs usually come with a high price. So cancer patients are more likely to be affected by the cost-saving practices of PBMs. If you're hearing any of the terms we have discussed, know that you're experiencing their impact firsthand. Knowledge is power. Understanding how PBMs work is an important first step in advocating for your care. A message from CancerCare. Learn more at www.cancercare.org. Congress is considering bills that would rein in the practices of pharmacy benefit managers nationwide. If you want to see change, we encourage you to reach out to your members of Congress with your stories. You can make a difference. CancerCare provides free resource navigation, individual counseling, and support groups over the phone, virtually, and in person with oncology social workers and resource navigators who specialize in helping people affected by cancer. To talk with one of our social workers, call 1-800-813-HOPE. That's 1-800-813-4673. Our social workers can help you navigate the emotional, practical, and financial challenges of cancer. The content presented in this video is provided for your information only. It is not intended as a substitute for medical advice. We encourage you to take information and questions to your healthcare provider